Hello and welcome to another episode of Gowing Life's Longevity Weekly with me, Chris Kerwin. Today we're going to be talking about three more fascinating topics, including pondering the question, can we live forever? My chat about living in an ageing world with Dame Camilla Cavendish, and the link between metabolism and our so-called zombie cells. But before that, please don't forget to like and subscribe to the channel as it really helps us out. Firstly, let's get into the headlines from this week. Sarepta Therapeutics in the United States has recently announced that they're recruiting young males with Duchenne muscular dystrophy, or DMD, to their Phase 3 clinical trial of SRP-9001, a drug which has previously shown leads to sustained functional improvements. Now, this is a major step forward for trials in DMD, and as a result for patients around the world who suffer from this devastating disease. Researchers have developed the first of its kind non-invasive wearable glucose monitoring device. Currently, there are no non-invasive devices commercially available, so people with diabetes must collect blood samples or use sensors embedded under the skin to measure their blood sugar levels. Now, with this new wearable device created by the Penn State researchers, less intrusive glucose monitoring could become the norm. Firstly, can we live forever? Now, to answer this question, we're going to have to look at something called longevity escape velocity. Longevity escape velocity is a point in the future by which every year medical or technological innovation will be able to de-age us by a year or more. This means that every year that goes by, this technology will be able to reverse our aging and break us free from the confines of biological age. Now, there is a small but very respectable group of scientists who believe that this is going to happen in the next century or so. Now, are these scientists completely deluded? Or are we too accepting of the fact of our own mortality? Firstly, I hope we can all agree on one thing, that we can and eventually will find a way to fully reverse or circumnavigate human aging. As Richard Feynman once pointed out, there is no law in physics nor biological mechanism to suggest that aging and death are inevitable. What makes the longevity escape velocity this century prediction more palatable is that when predicting the future, it is important to realise that human technological advancement is not linear, but exponential. Now, when using intuition alone, humans are actually very bad at predicting exponential growth. Take the following example. You begin with a piece of paper that is 0.1mm thick. If you fold it once, it's now twice as thick, so 0.2mm. Fold it twice, and it's double again, so 0.4mm. Assuming you could keep folding forever, how many times would you need to fold the paper for its thickness to surpass the distance between the Earth and the Moon, which is around 384,000 kilometers? Well, after 21 folds, the paper would be about 210 meters thick, so still very far off. But then after another 21 folds, the paper would have reached the Moon, with around 55,000 kilometers to spare. After around 94 folds, the paper would be thicker than the observable universe. Now, this point at which growth switches from deceptively slow to eye-wateringly fast is referred to as the knee of the curve. Typically, humans are hopelessly inadequate when it comes to predicting this. It's worth briefly mentioning the importance of artificial intelligence at this point. When it comes to extending human lifespan, there is a lot riding on the exponential development of AI technology advances, in particular over the next coming decades. Now, once human AI that exceeds human intelligence exists, we will have computers that can think and solve problems millions of times faster than humans. We could then have them develop new technologies for us, including better AI, at an unprecedented pace. So AI is possibly the most important ingredient to the exponential growth surprise factor, which is needed if we're ever going to get to the point where humans don't age. And secondly is my talk with the award-winning broadcaster and writer Dame Camilla Cavendish. Camilla is also a regular columnist for the Financial Times and is also the author of Extra Time, 10 Lessons for an Aging World. Now, in this fascinating talk, we covered all things from social care to living in an aging world and longevity. So here's just a little clip from that. So my final question, is there something, a conversation, a piece of technology, a word of wisdom, an idea which resonated with you that you would like to share to finish off this interview?
Okay, what I would love to share with you is a nursing home in Holland that I visited, where university students live in exchange for doing 30 hours a week with the old people. And as you can imagine, it is the most heartwarming, and it's very much a two-way experience. But what I'd like to quote for you is what the manager of that home said to me, which is, it used to be that when residents came, they had to fill out 100 questions on a form. Now they only ask you 3 questions. And the questions are, who are you? Who were you? And who are you going to be? And when you think that the average age of residents in that care home is more than 85, that gives you a sense of the possibility and the philosophy that we should apply.
Now I want to say a massive thank you to Camilla for giving us her time. It really was an amazing chat, so I'll leave the link in the description below. Now firstly, what are these zombie cells? Well, if you take a human cell and then try to grow it in the lab, it will divide between 40 to 60 times. After this, it will stop replicating. Now at this point, one of two things will happen. Either the cell will self-destruct in a process called apoptosis, or the cell will stop dividing in a process called senescence. Now these cells which go into this state of senescence are the ones that we call the zombie cells. And why is this? Well, firstly, it's because they don't die when they're supposed to. And secondly, they start to harm the cells around them by sending out inflammatory signals. Now the build-up of these zombie or senescent cells are one of the hallmarks of aging. A recent study reviewed the relationship between senescence and the chemical processes of our body, otherwise known as our metabolism. Now more specifically, the question they wanted to answer was, what is the impact of senescent cells on the metabolism and how might we address these problems therapeutically? They firstly highlighted the main metabolic changes that can drive senescence, which you can see in this image from the paper here. The accumulation of these senescent cells, caused by the metabolic alterations, then negatively impact our metabolism via 3 different methods. Firstly, changes to our fat metabolism. Secondly, dysfunction to metabolic organs such as the pancreas or the liver. And thirdly, the depletion of NAD+, a coenzyme important for the functioning of the mitochondria in our cells. Now, given the link between senescence and the metabolism, targeting one of them with therapeutic interventions might have beneficial effects on the other. In the paper, researchers lay out some possible strategies. The usual suspects pop up in terms of interventions when it comes to talking about health and longevity, i.e. reducing the number of calories we consume, reducing blood sugar levels, and of course exercise. In addition to these, a class of drugs called senolytics have shown some efficacy in removing senescent cells. Senolytic drugs are able to destroy senescent cells, which should theoretically improve metabolic health and might be used to treat metabolic diseases. Obvious targets are type 1 and type 2 diabetes, as senescent cells are known to play a role in both, and some evidence have shown beneficial effects for senolytics in mouse models. The effects of senolytics in humans is still an area of ongoing research, with uncertainty over their eventual effectiveness. And that is it for another episode of Longevity Weekly. I really hope you've enjoyed it and learnt something new. As always, if you'd like to find out more about anything that I talked about today, then you can go and check out the links in the description below. Also go over to the Gowing Life website where you can check out all of our latest news and articles that we're posting up on there. So again, thank you very much for listening, and I'll see you again next time. Goodbye.